Just after 1 o'clock on a Wednesday, welcome to the ACSA Legislative Lunch Break, along with Edgar Zazwata, ACSA Senior Director of Policy and Governmental Relations. I'm Naj Alikhan, ACSA Senior Director of Marketing and Communications. Welcome back. Hope you enjoyed our special Tuesday broadcast. Go ahead and jump onto our chat. Say hello. Let us know where you're watching from today. Edgar, how are you? Did you actually get out of that seat?
Hey, I was wondering, could we have just done it back to back yesterday? I mean, isn't this a trick in your guys' TV world? You just change the clothes, but you really just record it, at the same time. I mean, the questions would have been tough to respond to live questions that way. But
yeah,
it would have been efficient with time if we just stuck around for a little bit longer and doubled up.
Hey, look, if it was still just you and I in the office doing this instead of the rest of our staff, you could guarantee that I'd be in shorts and flip-flops today doing this, since our viewers can't actually see what's going on. Well, good to see you again, and good to see all of you again. Go ahead and jump into our chat. Say hello, Laura Dutch. On their very first today, ACSA President Charlie Hoffman is there. Ralph and Mark and Philip, so good to see you guys. We got a big show for you today. We have Dr. Sohil Sud, the lead on the Safe Schools for All, also from California Department of Public Health. He will be here to answer questions. I know that you guys are not shy about sending in your questions health-related. So you can go ahead and prepare for that. Edgar, before we bring on the good doctor here, I want to just go into our broadcast really quickly. Yesterday, thank you. More than 1,000 views of our show yesterday. We had nearly 400 people on the show yesterday live, which is incredible. The interaction was incredible. We had an earthquake in the middle of it, which adds to it. And we got some publicity out in the press for that show. Edgar, let's put a bow on that one. It was really, really great yesterday to see all of the members interacting.
Yeah, I mean, no pressure, right? I mean, sometimes I forget that there's obviously I see the people in the chat and I love interacting with them, but I forget that it's not just you and I and, our team behind the scenes kind of interacting. So no, I just appreciate everybody chiming in. Obviously, it goes without saying that this is an important time, a challenging time, however we want to characterize it. And I think it just goes to show how much the field is looking for, one, engagement, advice, direction, you name it. And my favorite part of the show, I think yesterday, as I mentioned, wasn't necessarily us giving perspectives. Obviously, our two guests were great. And I think the field hearing from their colleagues and having that shared experience. But I think my favorite part was seeing the chat and people giving advice to each other in terms of what they were doing with independent study, how are they handling the quarantine situations. So that was just a cool effect of the engagement, right? In this, if there's a theme of these last 18 months of where we've still had to have so many restrictions about being together, it's great that we've found a medium here to kind of connect folks. So thank you everybody for coming on board every week.
Yeah, absolutely. And I did mention that we got a little news publicity yesterday from the show. Of course, we had Kyle Stokes, great reporter over at KPCC in Los Angeles. He jumped on actually to the chat and asked some questions, so that was great. And then our good friend Mackenzie Mays, the lead public education reporter at Politico California, published a story yesterday titled "Schools Push for More Distance Learning Options, but Capitol Leaders Are Still Wary." Let me go ahead and just read a couple of quotes from Mackenzie's story. Here's the first one. While Governor Newsom's office confirmed Tuesday that the governor is working on cleanup legislation that would ensure districts can receive full funding for quarantined students, officials have insisted the governor will not allow blanket virtual instruction at some school districts want. Another quote, districts say state law recently approved by Newsom, which provides a limited path to virtual learning, but otherwise requires full-time in-person instruction, is difficult to keep up with. Enrollment in virtual academies is doubling due to Delta, and superintendents are struggling to staff the online courses with stricter check-ins and accountability rules. They say it would be easier to allow the broader distance learning of the past. This quote. Sorry, I'm gonna go out here on a platform on this.
I think I know where you're going, Naj. I think you're setting me up here, but let's go for it.
Sorry, I read it and was like, well, here you go. We have talked about the confusion, if you will, between what distance learning is and what independent study is. So let me go ahead and read this quote. This is from Assembly Budget Chair Phil Ting, Democrat from San Francisco. He says in this article, quote, virtual schools failed our kids last year, and the legislature has no interest in promoting that model, except for students with medical risks or in COVID quarantine. Schools should remain open. He goes on to say, quote, I'm proud to be an elected representative in a state which has followed its public health leadership and guidance since the start of the pandemic. School leaders can still offer high quality distance learning for those who cannot physically attend classes. Nothing in the independent study law prohibits that. All right, folks, I said it. I can't wait for our chat to start lighting people up. Edgar, you and I saw this a little while ago. Your thoughts?
All right. First, I'm gonna take my advice that I think I've said to our folks. I'm gonna give it to myself first. First is deep breath. Take a deep breath. Mm-hmm. Let's just say politely, okay, with all due respect to this assembly member, I'm gonna take issue with the first assertion that virtual schools, were a failure or whatnot. I mean, obviously, it goes with that. I think our members would be the first to admit that what happened last year, what's happened over the last 18 months, has not been ideal, right? Yeah. And that's in spite of all of the tremendous efforts of our members, our education leaders, our teachers, our families, our parents who had to sit by their computers and help kids because they couldn't enter the classroom, right? I don't think any of our members wanted it that way, right? And so I think just the primary assertion or alluding to the fact that somehow it was, I've heard this in many different sentiments, that what happened last year, that we can't let that happen. I think we'd be the first to say at ACSA that, yeah, we should be in-person learning, that does need to be the default, right? I think, and in fact, I think this is one, to your point, Naj, I think it gets confused. And, again, with all due respect to the assembly member, I think they might be missing the full point of the story. Yeah. I don't hear any of our members saying, let's go back to distance learning. Let's go back to how things were last year. Let's prevent kids from going into the classroom. No, I think in fact, but what I hear our members saying is there some common sense changes that we can make to this framework that the state created to enable us to more effectively serve kids while they're on quarantine, for those families that, despite our best efforts and showing them all the mitigation strategies we have in place, the Delta, as we're going to hear from Dr. Sud, it's real and it's having an impact, and it's having an impact on kids. And some families, despite our best efforts, are opting for that option. So I think there's just some fundamental confusion in terms of what even the ask has been. And what I hear our folks saying is just give us the tools to serve our kids. So anyway, I could go on and on. And yeah, I mean, so I think there's a bit of frustration in terms of just how the message is being heard from some of our leaders in Sacramento.
Yeah, and I want to remind our folks, several months ago, Phil Ting was a guest on this show. So, he has been with us. He has seen this format. And perhaps, and again, go ahead and drop it into the comments if you want your reaction to what he had to say. Our guest, one of our guests yesterday, Ivan Carrillo, from ACSA Governmental Relations, was quoted twice in this. And Edgar, this kind of goes to the point of where our advocacy can be, that pivot point where we need our members to advocate. Ivan says, quote, legislators are open to changing the law to accommodate some demands, including ensuring that schools will not be punished financially for low attendance numbers due to quarantines, and further broadening eligibility for substitutes to step in to make up for staffing shortages. All right, so we've talked, Edgar, about the influence of ACSA. Here it is. This is where there's a little bit of a pivot, possibly, but we do need the advocacy of our members right here.
Yeah, I think just what Ivan shared yesterday, and so it's been evident, in spite, and again, to Assemblyman Ting's response, I mean, he has a particular perspective on this. I will say that in general, I think what our folks are saying, and the frustration or the angst or them just telling their stories to policy makers is having an impact. Because I think what Ivan shared, and I think this is credit to the staff and the policymakers in general who are trying to figure out, is there some things that we can do, that we can tweak to try to not completely upend this? And, and that's not the ACSA position by any means. Is there some changes that we can make to this framework that will make it easier given the changing environment, given Delta, given what we've seen in our communities? And so I think it's reassuring to see that I don't think that, like Yvonne said yesterday, and I would double down on that, I don't think any of the changes are going to be as widespread as probably many of our folks want. But with that said, I do think that there's some opportunity to continue to massage this education code. And not just here in the next couple of weeks. I saw, I think it was Jim who asked for an update on the trailer bill language. No, nothing yet. This is still very much behind the scenes in terms of what they're going to work on. I think we'll hear or see something in the coming days. I'm sure we'll have an update on this come next week. But I will say, even after that comes out, I would really encourage our folks, that's not the end of the story. Don't stop telling your story. Don't stop contacting your legislators, even after this legislative session is over, which is going to be over in a couple of weeks. I think we're going to have to continue to inform our folks on what the real life implications been on the ground.
I like that Laura Dutch said maybe we need to invite him back onto the show. We'll see how that goes. Here's your advocacy point, folks. I want to encourage you. Edgar wants to encourage you. ACSA wants to encourage you to contact your lawmaker. Tell your story. Make sure your story is known to your lawmaker before they go in and they start making changes or just completely backing off anything. You can go to the Take Action button over on our website, ACSA.org. Click that hamburger button on the left-hand side. As soon as you click it, you'll go to the pull-down menu. Look all the way to the right. You'll see Take Action. Click it. You can get information specific to your area about your lawmaker, their contact information. This is that moment of which to do it. All right. Let's talk vaccines. Let's talk that piece of this puzzle. We've got a great guest for us today. Dr. Sohil Sud is the lead on the Safe Schools for All. He is the main man as far as talking points are concerned for all things COVID-19 and education. Dr. Sohil Sud is with us. Doctor, it is so good to have you with us on the show today. I just want to go quickly over some statistics because I do think it's important. Yesterday, Governor Newsom did give his news conference in Alameda County, announced that more than 80% of eligible Californians 12 and older have received at least one dose of the COVID-19 vaccine. Now, here in Sacramento, where more than 71% who've received one dose, so we're a little bit lower, but then there are other places in the state. I'll use Del Norte County. 45% of those eligible have received at least one dose. And of course, disparities. We talk about equity so much here at ACSA. There are disparities, minority groups, low income, the ability to have access to that. So what is the conversation right now on how to reach the unvaccinated people here in California, and how can schools be part of that campaign?
Yeah, thank you for the question, and hello, everybody. So nice to be with you. I'll start by saying the vaccine remains incredibly powerful still. You can see the split in terms of those who are unvaccinated and fully vaccinated with regard to who is hospitalized, with regard to who remains sick from this disease. So it continues to be an incredibly profound tool going forward. But just as you were mentioning, it takes more than just making a vaccine available in order for it to end up in the arms of those who need it and who are eligible for it. It takes it being accessible. And so on that front, we at the state and with the Safe Schools for All team are really partnering with schools down to that local level to try to make this work, to get the schools to be able to be one of many community resources that offer vaccines to their community. I'm happy to see if I can post into the chat the links to some of the resources that we have available. But we are talking about bringing those resources to the school, which includes hosting vaccine clinics, mobile clinics, providing vaccine supplies, connecting schools to local pharmacies, providing personnel. All of those options exist within the framework that we provided to increase school-located vaccinations. And it's going to take the community buying in and really believing in the power of it. The number one tool we can all use right now to protect our kids in the classroom is the vaccine itself, and that includes vaccinating teachers and students, but also the houses and the households in which those students live. We know household transmission is far and away the leading cause of spread of COVID-19, as it has been throughout the pandemic.
Dr. Sud, thank you for joining us today. And I know, as Naj gave you the introduction, and you're leading this Safe Schools for All team and giving support to the school. We know in practice, and you're kind of your job before you got here is your pediatrician, right? And I know as somebody with kids, always our favorite type of doctor, right? Like we put our kids' health in your hands. So we just appreciate you stepping up and trying to help the broader education community in your new capacity. So yesterday, you heard a little bit of in our intro, we had a spirited discussion with some of our school leaders about independent study. And one of the themes that I know you've heard is kind of some of the complications with quarantines, which we'll get into with some other questions. One of the factors or the variables that kept coming up is that's also dealing with staff shortages, right? That folks are just right now with everything going on, there's less feet, hands on the ground to cover all this. With that said, one of the things that's now, because the impact that Delta is having is contract tracing, and just the role that now school officials have to take in that process. I guess the question to you from the state side is, we've heard some counties helping schools now jumping in and helping on that contact tracing piece, because this is one of the themes we've heard, and you're seeing it already in the chat within our members, that they're just overwhelmed. Anything from the state front or in your coordination with county public health officials on what more can be done to help school officials on that piece of this equation?
Yeah, a very important question. To your intro, I'll add I'm still a practicing pediatrician. I have seen the manifestations of both COVID and what I would label the lockdown-related diseases, meaning the mental health conditions, the anxiety, and how that manifests in kids in the hospital itself. So really want to thank you all for everything you're doing to maintain in-person instruction. To some of the questions you raised, Edgar, I mean, no getting around it. This is hard. This is tough. And we all wish we were not trying to be in a situation where kids need to be in school, but in the middle of a surge. So we all know how important it is, but it is incredibly challenging. And I just want to tip my hat and give really credit to everyone who's making this work. I'm also a father, and my two girls, I feel that they're in school safely and successfully because of the tireless efforts of all of you. So really, from the bottom of my heart, I really appreciate it. But to the questions you raised, I'm fully aware that it is taking a significant toll on the system to make it work. And my conversations in recent days have echoed really much of the same sentiment that you just described too. So to that end, on the state front, some of the things that we're actively working on is number one, improving the actual process of contact tracing. We're hearing feedback that the actual way that our technical systems work in terms of data entry are cumbersome, and that's not insignificant. So we're working with our IT support to see what we can do to make that data entry process much more seamless for those who are involved in the contact tracing piece to be able to do so more efficiently. Just as you said, though, it takes more than just a process. It takes bodies. It takes personnel in order to make it work. So on that front, we are working tirelessly to onboard new staff, and then also working either directly and referring to groups such as the Public Health Institute, which can contract directly with schools to bring staff to campus virtually and in person. So working on getting more supports from individuals there. As you mentioned, local public health jurisdictions are also doing what they can to support schools, and it's increasingly noted to be a priority as they look at their contact tracing portfolio to really focus on the schools themselves. There are also, we're continuing to provide contact tracing and case investigation training, hosting forums for local public health jurisdictions to chat with us directly to address some of the questions that arise in outbreak investigations and management. And then I'll add, there are things that teachers can do to make the process easier. right? And so namely one can be seating charts that can really cut down on the workload to the extent it's possible in that space. There was another school we just chatted with a few days ago who was mentioning one of their first activities when they come back from lunch is to write down who they had lunch with so that they can keep a log on that front too. We totally understand that none of these are going to solve the immediate crisis immediately when it comes to the staffing shortages with contact tracing, but hopefully some of those will go a great deal to mitigate the issue at hand.
Dr. Sud, we get this question every single week, so we're going to ask you, and we have
every single day.
Yeah, I'm seriously, you're exactly right. Almost every single day we're getting this question. The question is going to be, is the state going to release any guidance on youth sports, music, choir, and Virginia Alvarez adds into that performing arts, music, bands, school plays. And then Helio Brazil asks, why are quarantines different for classrooms and sports? Okay, I gave you a lot there, so let's hit that first question. Is the state going to release any guidance on youth sports, choir, music, school plays? And what's the difference between the quarantines between classroom and sports?
Mm-hmm. Yeah, let me even broaden that question to start with, but then dive in, and happy to address any follow-up questions there. I played a lot of sports growing up. I understand the importance of it, both on the physical and the social development of kids. And I'll start by just saying that first off, the science suggests that much, not all, but much of the sports-related transmission occurs off the field of play. There was a great study done, by the NFL and a few other groups that have really showed that it's the weight rooms, it's the team meetings, it's the social gatherings that are substantial sources of transmission. Again, not all, but substantially contribute to it. And it's where we might expect COVID to spread. It's indoors with your mask off. And in that context, in the K-12 setting, the existing guidance should apply to those places. Namely, it's important to wear a mask during all of those off-the-field activities. That guidance already exists and is important to implement. While eating, distance and be outside if you can, ensure good ventilation. Those things can really not be understated. And so, that said, totally understand that there are some activities in which you can't physically wear a mask, right? You can't wear a mask while you're playing a tuba. You can't, or at least you shouldn't swim with a mask on. The state is developing language to support guidance on that front. And all I can say at this point is in recent days, there has been forward progress in that. So I can't make promises, but we're hoping to continue that momentum and to be able to release something. But what I don't want to get lost in this conversation is the application of the existing guidance to the sports setting and the importance of the off-the-field mitigation measures.
Edgar, let me just ask. Let me ask one addition, and Dr. Sud, I'll have you finish your thought on that. As far as sports are concerned, the games are already happening. We're about to hit week 2 with the games, and I'm seeing dates now out there for homecomings, and obviously you have band performances and things like that. So I'll have you continue your thought, but are we hitting that point where we've gone too far into some of these athletic seasons where it's difficult to even come up with guidelines because now they just add another challenge to what school administrators are trying to do?
Mm-hmm. Yeah, I think that's a fair point. I still think it's the responsibility of those of us in public health to set an appropriate public health floor of minimum safety standards, despite some variation in what might be going on throughout the state. But I will add that in this space where there hasn't been perhaps directed guidance, local health jurisdictions have released guidance in many contexts around sports. And so there are already places that are subject to local public health guidance in addition to the broader K-12 guidance around sporting related activities and bands and extracurricular.
Dr. Sud, I'm actually going to take one of my own questions out of order because I think it's timely on the topic. One of the things, and I think it relates to sports, but also relates to other activities such as PE or when kids are in recess, or you name it, and I think it's both masked and unmasked, is how to deal with exposure by the definition when it's outdoors, right? When kids have been outdoors. So I'll give a couple of examples. One, in the context of sports, if they're playing an opponent, we get word that somebody on the other team had COVID. There's no way to track who met that definition of being within 6 feet for 15 minutes, right? So then you have the struggle of who do you even quarantine? Let's make it even more complicated. They weren't wearing masks, right? So that's one example. Or let's go back to the school setting, even in a mask setting where kids are masked. Let's say it's a LEA, which I know more are going in this direction, just saying everybody's masked, even indoors or outdoors, but they're all at recess. And you pointed out that writing down who were you next to, who did you eat lunch with, it's still causing some challenges about who do we even consider a close contact. So then the secondary part is who do we quarantine? And this has been a source of, I think, confusion and frustration, because all of the science up to this point is that we do treat outside different, or we push so much of our activities outside, but now we still have COVID and we're having interaction outside, and folks are really struggling with how to deal with the quarantines in those situations. So just any general advice, or, will there be more here that folks can look to in terms of how they should be treating these situations?
Yeah, you raised a number of important points and questions within there. Let me see what I can do to address a few of them, but feel free to let me know if there's a follow-up that I can help with too. So I'll start by saying, in the school setting, the research has really shown that when both parties were appropriately masked, the chances of catching COVID from someone is exceedingly low. It's not zero, but it's exceedingly low. And of course, we all know the benefits of in-person learning, right? So given the low chances of catching COVID in that context and the high benefit of remaining in school, instead of quarantining from all activities, what we are recommending for an exposure that occurs in school, again, supervised exposure, mask on mask, we are recommending what we're calling a modified quarantine. So whereby the student can remain in school for in-person instruction, but should quarantine from all other activities, as in no group sports, no sleepovers, and all those pieces. In addition, because all of this research and even the experience of other states was all done pre-Delta, we are recommending that student who's remaining in school despite being exposed because of the mask-on-mask exposure, so we're recommending that student continue to undergo twice weekly testing as an added layer of security. While we're still learning more about that, reports at this time suggest that it's generally a safe way of keeping kids in school. So that's one piece around the way to approach quarantine, depending on whether the exposure was mask on mask or not. Now to your kind of second point about being outdoors, totally right that the spread is far less likely to occur outdoors. There's fairly robust evidence to suggest that. And that's the rationale behind masks being optional in an outdoor space as it stands. But that said, in the context of the Delta surge, there is some evidence of outdoor transmission, particularly in crowded settings. And in schools, it's unclear, oftentimes whether or not, depending on the context, whether or not you'd consider that a crowd or not. So we're discussing potential revisions to the definition of a close contact. But at this point in time, we are aligning with the general CDPH guidance and the CDC guidance that basically says a close contact is someone who you spent time with indoors or outdoors, less than 6 feet for more than 15 minutes. And in the school setting, if that exposure occurs, you need to quarantine. Now, again, you can undergo a modified quarantine or a standard quarantine, depending on if that exposure was mask on mask. But in both situations, they would be considered falling under the umbrella of quarantine.
You covered. I guess I'll just ask one quick follow-up. So any advice on let's say the unmasked? So if it is outdoor, let's either use recess or the example I gave in a sports activity where it's not clear who was a close contact, how far should those quarantines go, right? And I think that's where folks are struggling when there's, whether it be a sporting event where we can't determine who was the 15 minutes, 6 feet, or in recess, because right now the CDPH guidance does make masks optional outside if they happen to take them off for pee or whatnot. How any advice on how they should handle those type of quarantines?
Yeah, those are absolutely situations in which it is challenging sometimes to discern that. I think a few considerations along that process are 15 minutes of being less than 6 feet of someone is a significant amount of time. And if you picture a typical recess situation, it's very transient interactions that are at that close of a range. And so really understanding whether an activity is stationary or movement based, I think is one consideration in making some of those determinations. For example, eating during a recess time period versus playing on the playground, I think can be treated very differently. Another consideration can be the social circles of the student in question, right? To help understand how likely they were to be in close contact with other folks. And then to your point about sports, I think using certain sports in which there may be a higher degree of physical contact and more close proximity is a reasonable consideration in making that determination as well. So those are some of the ways you can go about thinking through identifying those who might meet that criteria.
And as we're crossing the bottom of the hour, just want to remind you that if you have questions or comments, go ahead and put those into our chat. Marie and Virginia, we saw your questions on there. We will try and get to those. Dr. Dave Garcia from Region 7 Empire Union School Districts asked this question. Considering COVID data, trends, and discussions within CDPH, what COVID-related issues do you see happening in schools 1 month from now, 2, 3, 4 months as we head into the new year? What are you seeing there?
Oh, I wish I had a crystal ball. That is such an important question. I think, overall, the state trends are showing what I hope continues to be the case, which is somewhat of a plateau in recent case rates and then potentially a slight downtrend. That's not consistent throughout every region of the state, but we are noticing some of that. And I'll add that overall, the recent numbers from kids suggest the same. And that's important to note because we're just testing kids far more than otherwise. So it wouldn't actually surprise me if we see that lag behind some of the other age demographics, since we're probably picking up more cases in that space. So I'm hopeful that the Delta is starting to run its course in California, but certainly can't confirm that. And I'll add to that really just gratitude for the work that everyone is doing along that front. I think we're seeing tragically high levels of severe disease in places with low levels of vaccination, including in children in other parts of the country. And thankfully, I think the collective efforts of Californians are averting much of that burden of disease in children because of the mitigation that's in place.
Well, Dr. Sud, you just collectively answered every question that was still there. So that was fantastic. Dr. Sohil Sud, the lead on the Safe Schools for All, a pediatrician and a powerful guest here on our show. Dr. Sud, thank you so much for being with us today. Have a great rest of the day.
Thank you. It's been my pleasure. Nice to see all of you.
All right, Edgar, that was a lot of information. I know that there's a good segment of our viewers that wanted that information on youth sports and those activities. And I think you and I have similarly been saying, okay, we hope it's going to come. We hope it's going to come. We hope it's going to come. And I would like to think that we got a little clarity that the discussions are happening, but maybe it's going to come. Maybe it's not. I mean, it's really kind of hard, it seems, to really narrow this topic down.
Yeah, and I think it gets to the broader issue, right? Whether it's sports, outdoor exposure, or even these pieces. I mean, my big takeaway here, and I hope I'm not speaking out of turn, but I think what Dr. Sud was saying, that there is some discretion here, right? I know some folks have been challenged in terms of like this question we get about how many of the kids should be quarantining, how far should this go? And here's the thing, we've got this question asked from like policymakers about, because we know that there's instances because of the challenges with contact tracing or other words that in efforts to try to mitigate the spread, that some of our officials are saying, okay, we can't determine who was within 6 feet for these 15 minutes. So we're going to quarantine everybody, right? And I think this is one of those challenges that we're going to continue to have to work through. And I think we'll take Dr. Sud at his word, and hopefully that there is more forthcoming, whether it be on exposure outdoors or if it is on the specific youth sports. But I think that's where maybe our folks it gives us something to think about how we're even approaching the quarantine situations. I'll be the first to admit, easier said than done when you're dealing with these complex environments. I think I lost the comment, but I think it was a good point. Little kids can't remember who they played with. Right? That's my son, what he did at school today. He can't remember 30 minutes ago. So I think these are some of the challenges where the public health guidance in the school setting, I think, as our folks know more than anybody, it can become really challenging.
I want to make note of this just to lead into this, the importance of this next 2.5 days. I know that Gina Potter, the great superintendent over at San Ysidro School District, our vice president for legislative action, if she was on the show today, she would be championing your need for advocacy inside the state capitol across the street to talk about independent study and share your stories. Edgar, I'm going to let you take on that message here. How important is it these next 2.5 days for our members, especially knowing the influence ACSA has with advocacy? How important is it to get involved right now?
Yeah, there's definitely the short term, and then there's some of the long-term objectives. As we talked about at the start of the show, there's some activity in the Capitol as we speak about making some of these modifications to the independent study, to some of these rules. I think if there's an opportunity, whether it be to send an email to your legislator, some of you have personal connections, just give them a phone call, ask to talk to their education staffer, give them some perspective about what's going on in your schools. I think that if folks can do that this week, that would be very, very important. What specific tangible changes could help you, kind of navigate this complex environment? Now, big picture, I don't want to send the message, hey, if I didn't have time, because I know you folks have your hands full. If you're, for whatever reason, you don't get to, make those contacts here this week, there is definitely opportunity and a role for us to continue to educate, the policymakers, the officials. I think we're going to continue to have these dialogues with public health to really think about some of these complex questions we had in the school environment. And to their credit, the guidance isn't always perfect at the beginning. I think, but continuing to refine it, I know makes our folks crazy because the rules keep changing. Yeah. But if they're changing to the betterment or to make it easier for our folks, I think that's something that the field is going to collectively welcome, right?
Yeah. Hey, I just want to remind folks, continuity of learning, that path of least disruption right now. We've made it really easy for you to find out the contact information of your lawmakers. You can go ahead and contact them. If you go to our website, ACSA.org, over on the left-hand side, there's this little hamburger symbol there. Click that, go all the way to the right in the advocacy section. Click Take Action. You can type in your zip code, your address, and your information, your personalized information for the legislator in your region, and their contact information right there. And Edgar, I assume when we come on the air next Wednesday, we'll have some news to report, maybe on what's happening over there at the state capitol. And who knows, maybe a guest that we've talked about a couple of times will agree to come on the show next week. What do you think?
I'm at a loss who you're talking about, but it sounds like a good guess. So I'm going to tune in. I'll be here. So
You'll be here. Wes isn't going to let us leave. That's why you'll be here. Wes isn't going to let us leave the office. All right, folks, thank you so much for being with us here on the ACSA Legislative Lunch Break. We are live and interactive Wednesdays, 1 p.m. Have a great rest of the day, great rest of the week. We'll see you next time.